Hello everyone. Our topic of discussion in this video is polyhydramnios. So let's study together. What is polyhydramnios? Anatomically, polyhydramnios is defined as a state where liquor amni exceeds 2000 ml. Or a clinical definition states that the excessive accumulation of liquor amni, causing discomfort to patient and, when an imaging help is needed, to substantiate the clinical diagnosis of lie and presentation of fetus. Sonographic diagnosis is made when amniotic fluid index is more than 24 cm or greater than 95th centile for gestational age, and a largest vertical pocket is greater than 8 cm. Etiology, or the exact cause of polyhydramnios, is not known. It may be result of deficient absorption as well as excessive production of liquor amni, which may be temporary or permanent. While some maternal and fetal factors are found to be associated with hydramnios, yet the cause remains unknown. In about 60% cases, composition remains normal. Some of the factors associated with this are fetal amylase such as anencephaly, spina bifida, esophageal or duodenal atresia, fascial clefts, and neck masses, hydrops fetalis, and euploidy. Other is choreangioma of placenta, multiple pregnancy. Maternal factors associated with hydramnios are diabetes, as due to raised maternal blood sugar level. Fetal blood sugar level also increases, which causes fetal diuresis. Another factor is maternal cardiac or renal disease. It may lead to edema of placenta and lead to increased transudation. Clinical types. Depending upon rapidity of onset, it may be divided into two types such as acute and chronic. Acute hydramnios is extremely rare. Onset is sudden within a few days or acutely on pre-existing chronic variety. It usually occurs before 20 weeks of pregnancy, and it is usually associated with monozygotic twins with twin-to-twin transfusion syndrome, or choreangioma of placenta. Symptoms. Features of acute abdomen predominate such as nausea, vomiting, abdominal pain. Signs: patients look ill. There is absence of features of shock. Edema of legs or associated features of preeclampsia. Abdomen is hugely enlarged more than the period of amenorrhea. Fluid thrill is present. Fetal parts cannot be felt nor fetal heart sound is audible. So these are the signs of acute polyhydramnios. Internal examination reveals taking up of the cervix, or even dilatation of the os, through which bulged fetal membranes are felt. Sonography shows multiple fetuses, or fetal abnormalities. Treatment part: most often spontaneous abortion occurs. In case of severe twin-to-twin transfusion syndrome, repetitive amnioreduction is done until the amniotic fluid index become normal. Laser ablation may cure the cause of twin-to-twin transfusion syndrome, whereas amnioreduction only treats the symptoms. Here we have seen about acute polyhydramnios. We will see in our next video about chronic polyhydramnios. If you like this video, then share it with your friends, and please subscribe to my YouTube channel. Stay tuned for the upcoming videos.